Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, and welcome back to another episode of HealthiHer. And today I have a really special guest. Are you actually from Italy?
I'm actually from Russia.
Okay, where are you at right now?
Chicago.
Okay. All right, I knew you were from somewhere far away. I didn't know if I was actually talking across time zones. But anyway, today I'm joined with Anastaysia, and she is an expert in functional aesthetic medicine and a national trainer for a company, and I'm just going to spell it for you, WiQo US. And it is a company behind this really cool treatment that we've brought into our office this past year. And the treatment is called PRXT-33. It's pretty new to our practice. Like I said, we just brought it in this year. And so that's what we're going to talk about. So welcome, Anastaysia.
Thank you so much for having me, Dr. Brenner. And thank you so much for letting me speak on this treatment, because I am as excited as you are about it, even though I've been working with it for a while.
So what's your background and how did you get into working with this company? And I got to be honest, how do we even pronounce the name of the company behind it?
Yeah, so let's start with the basics. The company's name is WiQo, and everyone kind of pronounces it differently based on, if they're from New York, California, or Chicago. So it's WiQo, WiQo.
Okay.
Mm-hmm.
Okay. All right.
Yeah. I am an RN. I've been basically in aesthetics for the last maybe 5 years, but I started in cardiac heart transplant and then went into research at AbbVie, and that kind of led me into aesthetics when the whole merge with Allergan was happening. Mm-hmm. And I've been doing that and working with a couple plastic surgeons, and the physician or the medical director that I have right now, actually his wife met the owner and the director of sales for the US when they were planning in Miami. And since we're all kind of friends and he knew that I do education and clinical research, they were looking for somebody to educate the US market on the product. And that's how I got introduced to the company. Later on, around 2.5 years ago, I was flown to Italy to meet the creator, the owner of the company, Dr. Castellana. She is an amazing, still practicing dermatologist. She's based in Trieste. She speaks zero English, but we were able to communicate. And that's just kind of how their company works. So I'll just tell you a little bit about it too, since we're on that topic.
Yeah.
The company started in Trieste, which is a small city in Italy. Not a lot of people know about it because it's not one of the popular cities.
Where in Italy is it located?
It's like really close to Croatia. Okay. So it's on the border of the sea. It's kind of away from that Italian boot where Rome is, like far away from that. And it's not really Italian, but all the aesthetic industry that comes from Italy, all the products that are made skincare-wise, they're all located in this city. So it's very aesthetically driven city. And Dr. Castellana has been in the aesthetic industry and dermatology for over 20, maybe even 25 years. And when she developed the product, she developed it for people who had scars, burn victims, and she needed to use something to restore their skin to a functional level, because you know that when we have somebody with a burn, it's hard for them to, let's say, use their arm. They can't unbend it. They have limited range of motion. And to treat them with something aggressive, to torture them again, to have them go through all that painful rehabilitation is not something that she wanted to do. So that's when this product kind of came into mind. She saw there was nothing like it on the market, so she just made it. And ever since then, that's how the company started. So if we go back to the name, so WiQo is kind of like the middle child. They have an overarching umbrella, which is called GPQ, and it stands for Dr. Castellana's husband's name. So Giorgio Piani is her husband, and the last letter is quality, so GPQ. And then they make other products, not just PRXT, but that's all we have for now in the US.
Oh, okay.
Yeah, so WiQo is kind of like the birthing mother of PRXT and the home care products that we see in the clinic and that we send our patients home with. So that's just one little branch of the company.
Gotcha. But today we're going to talk about PRXT. And we call it on our website a biostimulator, even though I've looked at other people's websites and they want to call it a peel because it's kind of the same process of what the estheticians or skincare specialists would do it's a similar procedure to administer like a chemical peel, but it's not a chemical peel, is it?
Exactly. And this is, it almost like, I don't know, sometimes gets me going when people don't understand the difference, but it's okay. It's so new on the US market that we kind of have to educate our patients, our clients, our staff on what the difference is. Because in the European aesthetic industry, and I practice in Europe as well, there's a huge market of different stimulators, injectable stimulators, mesotherapy, other things that we don't have FDA approved here or that we just don't use. And PRXT kind of blends the two worlds together. So it really is not a peel, because if we go back to the basic understanding of what a peel is, it basically means to peel off the skin. And we have plenty of other agents and plenty of other companies and plenty of other things that will do the peeling, from a physical dermabrasion to a dermaplaning, lasers, and chemicals. But PRXT of itself, the reason why it's not a peel is because we are not damaging the epidermal layer. The point of this treatment is actually not to remove the epidermal layer, but to keep it intact.
And so for our listeners, if they don't know what that is, the epidermal layer is just your outer layer of skin, right? So the most superficial layer. So it bypasses that, which is why there's no downtime. So go ahead.
Exactly. Yeah. So that outer layer of the skin is basically like our clothes. So as we're trying to get healthy, right, we're trying to eat clean foods. And when we get cold, we put on an extra layer of clothing. Same with our skin. If we don't take off the clothing, our body can keep, let's say, the heat, right? We keep our water retention. We're not sweating it out and so forth. Same with the skin treatment. So the reason why it's different from a peel is because with the peel, you will have all those flakes, all the redness, all the downtime, and there is a whole separate niche for the peels. And there are patients who really need a peel, who really need to remove that extra dead skin that's sitting outside, right?
Right.
But PRXT does something completely different. They definitely can be in the same protocol, not on the same day, but they can be combined together. But PRXT does what typically you would use, let's say, injectables for. When we're going deeper into the skin and we're stimulating our own body to regenerate and make new collagen, to make the skin more firm, more plump from within. So it's kind of doing stuff a little backwards than we are used to thinking with peels.
Right. So what exactly is it? So people who are used to peels, because really every skincare place that I know of offers peels of lactic acid, glycolic acid, TCA peels. People are familiar with that. Can you explain to people what's in PRXT?
Sure. So Definitely, if you're familiar with peels, you'll have an easier understanding of what this is. But a lot of people I tend to see jump to a conclusion without finishing the whole story basically. So PRXT in itself has TCA, a well-known peeling agent that's been around since the 60s, the 70s. It has hydrogen peroxide, which is a very interesting ingredient. Now, not a lot of people in the aesthetic world think about other than cleansing maybe the skin, and also the kojic acid. So the difference here is when we think of a traditional TCA, and for those who have never heard it or never tried the TCA peel, it's a very strong chemical peel. It's used for a variety of things like from superficial to deeper wrinkles, hyperpigmentation, texture in the skin. It's very strong depending on the percentage that we use, but it's also very well studied. And typically when we apply TCA to the skin, you will have a lot of downtime and you can cause a burn if you're not familiar with it. Where with PRXT, the way the formula is developed, the way Dr. Castellana created it, and there's a reason for the patent on this product, is because TCA here works completely different. You will never see a frost or this white cast on the face, and you should never see flakes coming off of the skin. So that's the biggest difference between, PRXT having TCA in there and your traditional TCA peel.
Right. I mean, I think some maybe plastic surgeons put even people with sedation to do high concentration TCA.
Exactly, yes. And I've seen some patients that came through our WiQo email where they said they've had a TCA peel and they've been treated by professionals. And this is how dangerous sometimes when we assume that we know something, but we don't go through enough practice or enough training. And the TCA peel was applied. This patient is left with no eyebrows.
Yeah.
So. Yeah, definitely a strong chemical.
Yeah. So how does the PRX, if you could explain to people, how does the PRX use such a high concentration of TCA without any downtime when it's such a aggressive chemical?
Definitely. So there's a really interesting story behind this because if we think of the chemical compound world, most of the chemicals have already been developed, patented. The periodic table is out there. We know most of them. But to combine chemicals together and to make sure that they're stable and they can still function and produce the results that we know them for is very, very difficult. So the way TCA in PRXT works, and that's where in the name you see the T33, that stands for the TCA at 33%. We know that TCA works by percentage, and we know that at a specific percentage, it will reach a specific level of the skin. It won't go any further. So at 33%, it's kind of like the middle ground where it reaches the papillary dermis, which is the layer that's right above the lowest layer where we don't want to go, where you will have severe burns, and that's really done under sedation. So when you combine TCA with hydrogen peroxide, it doesn't buffer. So this is kind of like that chemical scientific world that we'll get into a little bit. But there's such a thing in chemistry where we buffer things. So that's like balancing out an equation. But when we buffer things, we basically neutralize
I remember that
them.
from my organic chem days, like that term.
Right? You remember, but you're like, what is this supposed to mean?
That haunts me of buffering and that type of thing. But go ahead.
Yeah. So if you guys remember the buffering days, that means like we're pouring either a acid or a base. So something that's going to either balance the equation on both sides so it doesn't react. It doesn't continue to have a reaction. Where in this formulation, it's not buffered because when we buffer things, we neutralize them. And there's no point of applying it to the skin because we want something a little bit acidic on the skin to lower the pH because our skin is at a lower pH. And for acids to work, they have to be at the right pH for each specific acid. So here, hydrogen peroxide modulates. And modulation in chemistry means not to neutralize, but to stabilize and give a property to a chemical where it can surpass a specific environment. And that environment is our outer layer of the skin. Because if we apply just even hyaluronic acid sometimes, it doesn't penetrate. We know that. It only will sit on the outer layer of the skin. It's not going to go, deeper into the layers of the skin. So this way, PRXT has this TCA that's able to kind of go through these channels in the skin, and hydrogen peroxide is helping the TCA not to have that property of burning through the skin. So that's kind of how it works if we go into the simple terms.
Gotcha. So I explained at the beginning that the process for our skincare specialists or for people that have estheticians is similar to applying a peel. So can you just kind of explain to somebody, like, what is it like to get a PRXT treatment?
Sure. So I
know
tell
what
my
it's like. I
patient,
love it. So, but everybody else doesn't know, and they probably are used to, like, at least most of the things that we offer in our practice: injectables, lasers, peels. None of them feel good. There's always a,
yeah,
it's painful. Beauty is pain. You just got to deal with it. That's what's the beauty of this procedure.
I totally agree. And a lot of patients, when they're familiar with many of the treatments that we do and they hear something with a chemical in it, they're like, oh my God, is it going to burn? Can you give me a fan right away? And I tell them that this is not the treatment where you come in and I tell you, suck it up, or you're not going to get a benefit out of it. It shouldn't feel like that. And I tell my patients that this is kind of in between, like you said, the application of a chemical peel without the feeling of the chemical burn, but also it comes with a nice and firm massage. And I kind of get them in on the massage part, and then they really enjoy it.
Yes.
So that's like the hybrid in between your facial and your chemical peel with a little bit of a massage.
Right. I think that's a great way to explain it, of what to expect. Is it's kind of like a facial where you get a massage, but it's actually doing corrective measures to your skin, unlike a typical facial that, you get when you go on vacation.
Exactly. So, and a lot of people forget that this is actually a very stimulating treatment because of the ease of application and the ease of no downtime. We've had patients that come in the day before the wedding. We've had patients that came in off of the beach and they're getting a treatment. But not to forget that this is still a very strong, stimulating treatment to restore the skin's health.
Yeah, I think when you said, like, right before a wedding, I particularly loved how I felt that day and the next day. It's a great treatment to do right around an event or a vacation.
Definitely. And it's something that doesn't just give the Cinderella effect, even though we see it for the first couple of days because of that inflammatory period in the skin where everything is just so luminous and plump. Makeup applies like no other. It's smooth. You don't see the pores. And then within the next couple of days, like that kind of wears off a little bit, but you still get the stimulation of the collagen. It starts to build. We just don't see it, and patients kind of forget about that, and they come back and they want to get it more and more and more.
Yeah, I like your name for it. I haven't heard that before. A Cinderella treatment. I usually called it an event treatment, but I like your words much better. A Cinderella treatment.
Yeah,
I like it.
Good.
So what can people expect? We talked about, the Cinderella effect, but what can it do kind of over the long run? What can people expect with the PRX treatment?
So I tend to focus in my practice, and it's one of the biggest personal pains for me is acne scarring. So I tend to focus a lot on that. That's kind of my demographic, and also stretch marks. But generally, it is able to restore turgor of the skin. It's able to restore luminosity, hydration, tightness, all of the areas on the skin that we typically will put a little bit of filler, like superficially to plump out the skin, or where we put threads to plump things out, you're able to basically stimulate your own skin to plump back up with this product. You're able then to further combine it with other treatments. You're able to work on the depressed scars, on stretch marks, not so much on hyperpigmentation that's melasma-like. It will definitely lighten some of it, but it's not the targeted treatment for that.
Yeah. And your point, because you mentioned stretch marks, is this isn't just for the face. It can be put on really any skin where there's a problem issue that needs to develop collagen.
Exactly. And somebody asked me at one of the conventions, I believe it was in Vegas, what is the elevator pitch for this product? And I had to think for a second, and I think you can use this as well. So 3 things you can say in less than 30 seconds about this is basically any season, any age, and any Fitzpatrick type or any color of our patients that come through the door. You basically have no age limitation for this product, and you can do it at any season.
Yeah, you bring up a Fitzpatrick type. What that means is, we have people walking around who are very light skinned. So somebody like Nicole Kidman with, she probably burns if she just, walks to the beach. Or versus somebody that's African American would be a skin type 6, or, anywhere in between skin types 1 through 6. And you're absolutely right. There's things in our practice that aren't appropriate for people that have dark skin. So, like our CO2 lasers, our BBL treatment, because of the risks of damaging the skin and altering the pigment of the skin long term. So having treatments where it doesn't matter what skin type you are, or if you have a tan, that's really important that you can do it to anybody whenever.
Yeah, and also for me, because I've seen younger patients who come through with their parents, and let's say they have a varicella scar, and it's right smack in the middle of their face, and we cannot treat them with filler because it's not FDA approved for those who are younger than 18 years old. We definitely can use this treatment for those patients and restore back their skin to a more even appearance where the scar is not visible as much anymore.
Yeah, I never even thought of that, but you brought up a great point for younger people with acne scars. Of people have asked me like, I want my teenager to get this laser or microneedling or RF microneedling. I'm like, ugh, those are a little ouchy. So this would be a great option for really somebody that doesn't want the ouchiness, or particularly teenagers who don't want the ouchiness of those more aggressive treatments.
Yeah, you definitely bring up a great point. And to add on to that, people ask me like, well, why would I want to bring this on to my practice? I already use something for scarring. And I had the situation where the lights went out and the machines were not working. And all I had was PRXT and my microneedling roller. And you definitely can do a liquid laser treatment with that. That's very much comparable with results to what you can do with a laser.
How many treatments do you typically recommend people get?
So it really depends on what they're looking for in the long term. Because if we're talking about collagen stimulation as the primary kind of goal of the patient when they come through, to stimulate collagen, we know that it breaks down every day, right? And it also depends what we eat and what our lifestyle is like. We want to stimulate our collagen or our fibroblasts, the little cells that build collagen, probably anywhere from 3 to 5 times within the period when the skin renews. So between the 24, 25 days to 30, depending on the age bracket that the patient is in. So I say a good starting point is probably around 4 to 5 sessions that are done every week. So 7 to 10 days apart. If we go longer, that kind of defeats the purpose of, kind of going to that chemical stimulating skin gym and building that kind of firm body or firm face. And then after that, I have patients who come in either for monthly maintenance, or if they want to come in after 3 to 6 months, some come in later. It just really depends on how long they physically feel and see results. There's no harm in coming in a little bit earlier to get, let's say, a full set of treatments between the 4 and 5 or 3 to 5.
Gotcha. So you mentioned that this is, started in Italy and probably went through Europe first. How popular is it right now in the United States? How many practices are offering this?
So I see this blowing up more and more in the US. So we've been FDA cleared for over 2 years now. It's all over the US map right now. And I see more and more spas and dermatologist offices and clinics starting to use it because of the patients that we're seeing right now. Everyone wants real results the way they walk out of the clinic. I feel like we're in that period of time where we don't have time to wait for the results. We want to see something right away. We want to have the pleasure of paying for service and seeing the results right away. So it's becoming more and more popular within the last couple of years. It's just blown up, and we've had doctors who own clinics perform and speak on PRXT and at the numerous conventions, and how much the revenue that they're getting just from this service or just by adding this service. Some of them make over $1 million.
Yeah, so obviously it's very popular. I just love it because it's just something that actually works and can make you have better looking skin and look younger, look refreshed, but you don't have the downtime and it doesn't hurt. So I love the results of some of our more invasive things, but I'm also just the worst patient and don't like pain either. So
I agree. It definitely is one of those treatments where, let's say, we typically have brides come in and they're like, I really don't know what I need. I don't have time, and I need to look good yesterday. And this is one of those treatments that you can definitely do on these patients.
Yes. I think that about covers it. I can't think of anything else that our patients would need to know about PRXT. Can you?
Other than it's very important that you make sure that you speak with your provider about what you're supposed to be doing at home. And I like to remind my patients that 80% of their success with their skin comes with them using proper products at home. So even though, we will provide best treatments for our patients based on their needs, but it's also important for them to stick to our recommendations. So that will give them the success of having the glowing, beautiful skin that's healthy and vibrant for a really long time.
That's great advice. Yes, you definitely want to protect your investment. So thank you so much, Anastaysia, for taking the time to educate our listeners about this awesome treatment of PRXT.
Thank you so much for having me.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.